Right, good morning Queensland, good morning Brisbane, and good morning to all of our Facebook Live followers. And it's wonderful to be with you today on this glorious Brisbane day. And can I say from the outset a big thank you to Queenslanders for the amazing work that you're doing. I know there's thousands of families at the moment on holidays, enjoying their school holidays, the long weekend, people are out and about and enjoying the fresh air, the beautiful sunshine. And thank you for everyone for doing the right thing. We are very, very appreciative. And it's the work of you that's actually helping to keep Queensland safe and continuing the fact that Queensland can continue to enjoy our lifestyle, even though we have a few restrictions at the moment. So today I can report that we have 0 community cases. That is just outstanding. We have 1 case in hotel quarantine. We have had, and this is tremendous, 18,427 tests have been done in the last 24 hours. So that means Queenslanders have answered our call to come out and get tested. Now, we're not out of the woods yet, so that means all Queenslanders, if you have any symptoms whatsoever, please come out and get tested. And good news yesterday too, 19,256 people came out to get vaccinated. Now, vaccination is the key. I've said that time and time again. It's a beautiful day. I caught up with the family last night. Their son and daughter are going to get their vaccines today. So make it a family outing. If you're going out to South Bank, drop into the convention centre and get your vaccine. There's hubs right across Queensland and they're accepting walk-ins. So there's really no excuse not to get your vaccine. Now, we've had 66.96% at least 1 dose and 47.98% of eligible people are fully vaccinated, which is absolutely tremendous news. So, of course, we've got a few restrictions that are in place across Queensland about limits to your homes, and of course the square metres for restaurants and cafes. And I thank all the business owners for doing the right thing as well. I know it's been tough on you, but it's tougher if we were in a strict lockdown, and the fact that we don't have any seating or community cases means that we can continue to enjoy our lifestyle. But like I said, that could change at any moment, and the key is vaccines. What we know about this virus is it'll hunt down those people who are unvaccinated. So that is the key, to please go and get vaccinated. So I hand over to Dr. Young, and then we're happy to take some questions. Thanks, Dr. Young.
So excellent news this morning, no community cases. And can I thank every Queenslander who's been involved, because it's astounding that we haven't seen community seeding, and that's due to the work done by Queenslanders every single day. You clearly know how to respond in a pandemic, and you're keeping yourselves, your families and your communities safe. So thank you for that. And also thank you to everyone who's coming out to get tested. I know it's a nuisance, but it's so important. And because of that enormous amount of testing, nearly 100,000 tests have been done related to this cluster, I can be confident we don't have community seeding. So please keep coming forward, any symptoms at all, no matter where you are in the state. Because I think one of the reasons we've been successful in containing nearly 50 incursions of the virus in the last few months is because we're finding pretty much the first case in each outbreak. And that means we can get on it really quickly. And thank you for the help that people give our contact tracers. I know it's really hard remembering where you were up to a week ago, but it's so important. So to make it easier, when we do have another outbreak, if people could really use that check-in app, because it's not only to find the contacts, but also to find where people have been when we interview them. Because a lot of people just don't remember, and I understand why. They don't remember which cafe they went to, or which surf club, or which shopping centre. So if you check in, it's all listed there. So we can immediately get that list and work on it. So please use the check-in app, it helps enormously. Make sure you follow the restrictions, because they help enormously, and the vast majority of people clearly are. Wear masks when you can't socially distance, and just keep one on you at all times. And then the thing that will get us out of having to do all of that is to get vaccinated. So we're really creeping up there. We're almost at 50% double vaccinated, which is fantastic. So there is somewhere, anywhere, everywhere in the state where you can get vaccinated. To a pharmacy, a GP, one of the Queensland health clinics, there is somewhere in your community you can get vaccinated. So this long weekend, please come out, the whole family, 12-year-old and older, mum, dad, grandparents, everyone, just come out and get vaccinated. That's really important. Thank you.
We're happy to take some questions, but as Dr. Young said, please make sure you're checking in, make sure you're carrying your mask, and make sure that you're wearing that mask, especially when you're going indoors. And you can only remove that mask when you're seated if you are eating or drinking, and put that mask back on. This is the key, everyone. So vaccination, mask wearing, and to make sure you're using the check-in app. Sorry? No, we've said very clearly, if there's any community spread, right? If there's any community spread, we'll look at those cases, but that could happen. So the key is to go and get vaccinated. Yes, as long as there's no issues that arise this afternoon, it's my intention to attend. And can I say to the people who are attending, please, you have to check into the stadium, you have to wear your mask in there, and you can only remove your mask when you're seated if you are eating or drinking. That doesn't mean sitting there with a beer and having the mask only when you're drinking. And we've got to do this to keep everyone safe. So I'm making it very clear that these are the conditions that have been put on by Dr. Young, and that's what I expect everyone to do. Yes. Yeah, it's not about ICU beds, Lydia. It is about all of the states and territories being prepared. And what we know in New South Wales is they're about to see a massive surge. They're seeing the surge in Victoria, and what all of the health ministers have done. I notice Queensland's getting singled out again, but let me make it very clear. All of the health ministers across the nation have written to the federal health minister because they have not had to deal with the pandemic of this scale before. So I've always said this is uncharted territory, and this is a great opportunity for the states and the federal government to work together. Now, National Cabinet was a very good meeting on Friday. I want to commend the Prime Minister. It was a very, very good meeting. All of the states and territories went in there with the objective to keep Australians safe. And that's great that we're seeing that. We're getting some further work done. And as you can appreciate, and I hope Queenslanders can appreciate, we've got to get the work done to get it right. Now, we're looking... Sorry? I don't think any hospital in the country would say they're ready. Okay? Anything else?
Wales, have you got any remarks about your counterpart down there, the Premier?
I made a statement the other day. I mean, it'd be a very difficult time, and like I said, I wish her and her family all the very best. And, you know, contrary to public commentary, I always found Gladys very good to deal with, and I have deep respect for her, as I do all of my colleagues.
On her successor, there's a few...
Well, I'm not commenting on that. That's a matter for New South Wales. I'll work with whoever they have. Well, the whole nation is working on this. The whole nation is working on this, and further work is being done because the modelling needs to be right. So there's a lot of work done. Queensland has been preparing, and Dr. Young has been preparing for this pandemic before the pandemic actually happened. So she made sure that we had the ventilators ready. She made sure we had a stockpile. This is going right back to the start of the pandemic. So I think everyone should understand that these are very, very difficult times, and this is where the cooperation of the federal government with all of the states is needed, and that's what we saw last Friday at National Cabinet. Yeah, and so what we're looking at there, Lydia, if you read the correspondence that was sent to Greg Hunt by the Health Minister, it's quite detailed, is now that there is a lot of work happening with Professor Murphy in identifying those people who are currently occupying, who are aged care and who have disability, who are currently in our hospitals, and transitioning them out to free up bed capacity. And that's great to see. This cooperation is unprecedented. It is really good to see, and I commend the Commonwealth for working with the states on this issue. Look, we're looking at the results of that. Yes.
We're getting anywhere near 50,000 vaccinations a day. I keep hearing Ned Young saying that every day we're not in a lockdown, there's a chance to get 50,000 vaccinations in people's arms. But we're not getting anywhere near that. Why are we not reaching that 50,000 day?
My understanding is that we are, because this is the state. This is what we're doing. There's also what the GPs and the pharmacies are doing. So if you look on that daily update that the federal government puts out, it's a weekly update. I get that and I go through it, and we're actually over that, my understanding. This is the state. This is Queensland Health. This is what Queensland Health is doing. But we're actually seeing a bigger uptake now too across our GPs and our pharmacies, because the pharmacies have got Moderna.
So for instance, Jeanette, I don't know if you know, in the last 24 hours, combined all those together,
Yep.
are you getting over 50,000 a day?
The Commonwealth doesn't report on the weekend, and so we'll get that data on Monday and be able to see it. But they're also 2 days behind.
But on a daily basis, what you're seeing over 50,000?
Yeah, over 50,000 combined. Yeah. Yes. That Atagi's doing that work at the moment. Yeah. Our hospital system is ready, but it's going to have a lot of requirements on it. So we've been dealing with this now for almost 2 years. So it's ready, it will manage it. But at the start of the pandemic, we did a lot of work with the Commonwealth, and we made a lot of capacity by moving people under the NDIS and aged care to their more appropriate long-term accommodation. That's come away again, so those numbers have started building up again. So we're just starting all that work again.
Capacity there, because we're here in New South Wales, their ICU capacity is 3 times what it normally is, around 1,500. They
Yeah.
have about 500 beds. What is
Yeah, so we doubled our capacity. That was our planning at the start. We've never needed that, but we could increase it even more. So we've done a lot of work.
How many beds is that?
Well, we will create the beds that are needed, because it's not the bed that's the important part, it's the staff. So we've done a lot of work about training up staff and getting that prepared, and we've also bought a lot of additional equipment. So we have plenty of ventilators, we have the consumables you need for those ventilators, we have the drugs you need. So all of that work's been done.
Likely that you'll be able to keep patients in hospitals, or will you have to reactivate something like we saw at the beginning of the pandemic, that convention centre inside the showground as a makeshift hospital?
We've never had to do that, and I doubt we'll need to going forward. We're just looking at the current trials that we've done. We just want to tweak that app a little bit more. There are a few things we want to do.
Yeah, it was a great discussion on Friday at National Cabinet. No, not at all. I don't have a worry about that, because the key is vaccination. So we want as many Queenslanders as possible vaccinated. And like Dr. Young's been saying and I've been saying, we want to make sure that every eligible who's in the cohort has the opportunity to get that vaccine. And what was discussed at National Cabinet was that there'd be a trial happening through New South Wales, and let's see how that trial works. I mean, I think that's great. It's great they're having a trial. In relation to? Look, I haven't got those results yet, but from my indications, it's been quite positive, yeah.
Last couple.
Last two? Yeah, they're working through that. My understanding is that there's about 3,500 people in about 19 hotels, and the domestic and international is roughly 50-50, which is quite good. and our capacity is around 3,800. It changes each day because people come out and then it frees up capacity. But of course, we wouldn't be having this if we weren't in a pandemic, and we wouldn't be having this if New South Wales and Victoria weren't in a lockdown. And that's what we are doing to try and keep Queensland safe. But we know this Delta virus can pop up at any time, as we've seen over the past week. Now is the time, Queensland, to go and get vaccinated. If there's one thing you can do to not just protect yourself, but your family and the community, and to protect Queensland, is to get vaccinated. So the walk-ins are right across the state, and please, beautiful weekend, take the family, go and get vaccinated.
Premier, just on the grand final, are you pretty...
Sorry? I think I'll be getting the results in the next week or two.
Sorry, just on the grand final,
Yes.
pretty stoked if Queensland and Central went out and save NRL this year, so last year. You think it's pretty amazing that we've got the grand final tonight and it's actually done with it?
Look, I just want to thank. It's because of what Queensland's done that it can go ahead, and you know we're happy to help out other states. We helped Victoria out last time. New South Wales wasn't able to host it. Football brings the community together. The Olympics brought the world together. It has to be in a safe environment. There have to be COVID-safe plans. They were all put in place, it's going ahead because Queenslanders have done a mighty job.
Game on, who are you backing?
What I mean is that there is a global pandemic, all right? So we don't know what the future holds. So Dr. Young has had everything prepared. The health system is prepared, but I'm not looking through that. I don't have that crystal ball. So we just have to do everything we can within our capability, but we don't know. We'll learn from what happens in New South Wales and Victoria over the coming months. But what we've seen around the world is that you end up having very tired workforces because the workforces are going, 7 days a week. A lot of places in the world, they're exhausted. That's one of the reasons we're opening up the international travel for students to come back when WellCamp's done, for health courses to come in. I think that's the key, especially in our rural and regional areas, because those students end up helping out. So look, these are extraordinary times, and we are preparing as best as we can, and that cooperation between the states and the federal government is critical. And we saw that cooperation on Friday. If people end up being very sick, they'll come down to the bigger hospitals. They'll be transported. We do that. We do that now.
Game on tonight, who are you backing?
Who am I backing? Well, there's not a Queensland team,
That's what I'm asking.
so I'll back Wayne Bennett's team, the Rabbitohs. All right.
There's a Queensland.
There we go. There's a Queensland link there. There's always a Queensland link. Yep. Look, New South Wales and Victoria, they can come and join our time. There we go.
We're getting
Why not?
Olympics, though. Surely you'd want to eventually actually move it with the rest of the country.
They can move into our time. They can move into Queensland time. All right?
Everyone.
Thanks. Have a nice day. Thanks, everyone. Thanks, Mikey.
Thank you.